Okay, good evening. This is Dr. Garais, your host, and this is Med210 4NAX. And of course, if you haven't emailed me yet, please email me regarding the labs, because the laboratories have already started on campus. And I need to also email you like on what to do, where to go, and all that, because if you don't email me back, um, I I cannot reserve a spot for you. There are specific reservations because we don't want to have too many students on campus. Okay, what's due today or tonight? Task 5, discussion 5, and lesson 5, because this is now, we are now officially into week 6. And week 6, we're going to talk about the skeletal system. And let's look at our goals for this evening. And of course, we're going to talk about what actually is a bone. And maybe you haven't really thought of it, that a bone is an actual living thing. And it's hollow. It has things inside of it. And they serve more than one function. You may think that your bones just, a place to hang your muscles, or maybe something to protect you when you fall. But it's a little bit more than that, and there's a lot of things going on the inside of bones. Of course, support and movement. We kind of talked about that when we talked about muscles, but now we're going to add the other component, which is bones. And then there's going to be like a mini sub-lecture on joints. And it's actually a separate chapter in your textbook, but it's really, I can break it down into a half page of notes that breaks down your joint spaces into 3 particular categories. And that's why they kind of tacked it on and added on there. And again, these videos are really good. And just like, what do you call that? It just like, muscles, knowing your bones is also practice. And also you have to go look at all the different types of bones. And I will also include in the notes, I'll make a note right here, that I have some practice pictures and things of that matter, so that you could practice. Let me see if, okay. So now the textbook is in your, in your previous MED 110, or you could just Google OpenStax, and that's OPENSTAX. Let me open up an MED 110, and it's this website here, openstax.org, and they have its own, of course, anatomy and physiology textbook. So, book detail, table of contents, and I'm looking for bones. There's muscle, there's integument. Here you go. The skeletal system. And it goes straight, and this is neat because it goes straight down the line of our topics right here. So let me move this out of the way. Okay, so when we look at the bone, what is its function? Of course, it's supposed to support the body. And because if you didn't have any bones, you'd just turn into, a big bag of guts and nothing to hold it up. Also facilitates movement. Those of you who've ever broken a bone know that you don't move very well. Even when you break a finger, broke my hand when I was a teenager. It's just the little bones in your finger, but you don't move very well. Even walking around, even the weight of your steps hurts. It's very, very painful. Another thing that the bones do, of course, is protect your internal organs, like your rib cage, right? Your your spinal cord is protected by your vertebrae, and it also forms hematopoiesis. It forms blood cells because remember what I said a second ago, that your bones are hollow, and we kind of know our bones are hollow for anybody who's ever had what soup is that? Soup with like beef stock in it, and then you put like big chunks of bones in it because it's delicious. It's salty, and that salts come from all the blood cells. It also has a lot of minerals and fat. And those of you who are meatitarians, such as myself, who love a good T-bone steak, that's one of the best parts, near the bone part. And it has all the fat in it and all the juiciness because there's blood cells in it, there's fat, and it's delicious. I hope I'm not making anyone hungry because I haven't eaten either. But you could see that bone, it's a little bit more complicated than just supporting your body or facilitating movement. There's a lot more going on there. And there's also these minerals like vitamin D. It gets stored in there, and it gets processed in there, and we're going to talk about that. Now, bone is hard because of the mineral deposits that are in it, like calcium carbonate and magnesium sulfate. That's the only difference between bone and cartilage. Now, we're going to be talking about joints that we also need things that are hard but kind of flexible, and that's cartilage. But bone in general has to be hard, has to be dense, and it has to be able to support and protect me. And remember, it's a skeletal system. So even though we talk about it in just the singular concept of bone, you kind of now it's related to my blood. It's related to minerals and fat and other things. It has its own blood supply. It has its own nerve supply. And like I said, if you've ever broken a bone, it has a nerve supply. It hurts like heck when you break a bone. And this gentleman right here, he's not trying too hard. Barely has 90 pounds on this rack. Oh, maybe this is the rest of the rack. I don't know. Doesn't look too much. But let's look at, and of course, orthopedics, right? Ortho, straighten, ped, walk, right? It is a specialty that deals with your bones and deals with your movement. And also, they have subspecialties in sports medicine because who would most likely break their bone or cause some joint damage is an athlete. Now, it has mineral storage, it has energy storage, right? And we're going to be showing you momentarily how inside your bone has yellow marrow and red marrow. So inside the bone, there's yellow marrow, and that, of course, is the storage form for fat, right? That's why bones taste so good. And red marrow is the storage form or area for hematopoiesis, or the production of red blood cells. Okay. So let's look at how you, the first way you got to look at things is how do you classify bones? Because there are like 206 of them, and there's got to be some organized way to look at it. So one form of classification is its shape. So one example are flat bones. So this is your sternum or your Manubrium sterni, right? And this is the corpus of your sternum or the body, right? Your Manubrium, I always think of it like a necktie, and this is like the winter knot of the necktie. So that's your Manubrium, and this is your corpus or your body, and at the very end is your xiphoid process, which is actually made out of cartilage. But you can know that your breastbone right here is flat. Another tricky one is your skull. If we were in class, I could show you how the skull is actually just like a molded pancake, and it is also considered a flat bone. Long bones, such as the bones in your appendages like your arms, fingers, and your legs. This is your femur, your largest, longest, heaviest bone. It is very difficult to break. You see in movies how people break these things with bats and, or you know, with a stick. No, typical femur, you need like a truck. The only time I see femoral fracture is when my patient gets hit by, you know, things like UPS trucks, DHL trucks, that kind of thing. Sesamoid, because it looks like a sesame seed, right? Oid means resembling, right? And that is your patella or your kneecap. You also have sesamoid bones in your ankles and your wrists. And your wrists are called your carpals. And of course, your ankles are called your tarsals. And then you have bones that are just way too weird. They're called irregular, right? The short bones are your, of course, wrists and ankles. Then you have irregular bones, which are just too weird. And your vertebrae is one of them. But you could see here how there's facets here that connect to your ribs, and there's a space here for your spinal cord. And these facets, and you could see these here, there's these little notches here, and they're called lamina, and they house your spinal nerves. So you have your spinal cord here, and that comes out the spinal nerves. So you could see if there's something wrong, misalignment of your back, or maybe you have a fracture, you could damage your spinal cord or your spinal nerve in this area here called your foramina. Okay, so that's long bones, short bones, flat bones, irregular bones, sesamoid, and there's a nice little bone classification. Okay, nice little chart there with examples. It's the same thing, but in chart form. This is a beaut. Let's slow down and take a really good look at this one. Okay. This is the anatomy of a long bone. This is a classic bone, and now you can see that the bone isn't actually solid. It's actually made up of several layers, and you could see that there's a periosteum, and there's other, the periosteum is the outer layer. You could see that the bone is made out of a more compact bone here, and then on the ends, called the epiphysis, or for plural, epiphyses, you could see the bone is actually spongy or trabecular-like. There's a lot of little like nooks and crannies and spaces. And this is where the red and the yellow marrow will also be housed, okay? So the concept behind long bone is this. It's just like how carbon fiber is very, very strong and also and very lightweight. Same thing with your bones. They're very, very strong and they're very lightweight because there's spaces in between, and the strength comes from these multiple layers starting here on the very, very outside, and that's called your periosteum. Peri meaning surrounding, and then of course you have another set of layers on the inside called your endosteum, right? So endo means inside. Now you have to see it as, you know how you could take like a newspaper? If you look at a newspaper and you look at its like separate pages, it can't hurt you. If I hit you with a couple of pages of a newspaper or a magazine, you look at me like, hey, what are you doing? Right? It would mean nothing to you. But what happens if I rolled it up really, really tight? The way the periosteum here, right, the outer layer, and the endosteum and all the compact bone gets rolled up really tight. It will still be very light, but it will hurt if I hit you. Actually, I always tell the story about I was in a martial arts tournament when I was a kid, and there was a demonstration. One of the masters took a rolled up newspaper and broke a cinder block with it. And when I was younger, I was like, oh, this is magic. Nope. Now that I'm older, I know and understand how physics works, and I know and understand that You can break one twig very easy, but if I take a whole bunch of twigs and I wrap them around really tight, it's very, very difficult to break. And that's what gives the bone a lot of strength. So the diaphysis is the main shaft, or the center part of the bone. Then you have the end parts, which are called epiphysis, right? And then on the end parts, you will see that there's articular cartilage, okay? And that has to be cartilage, because that can't be hard. It has to be soft, so that there's like so there won't be like bone on bone contact. And when you have bone on bone contact, especially when there's damage or when you get older, that's when we have pathologies and have problems with the joints. Okay, so again, you have spongy bone. That's going to be this bone that's got a lot of spaces. Then you have compact bone, less spaces and more layers. Okay, you have this thing called your epiphyseal line. Your epiphyseal line, that's the point of where your bones grow from when you're younger. Okay, and then when you get older, it forms an epiphyseal plate. Okay, and that's also how we can also tell age the patient. Maybe you saw NCIS or some one of those forensic shows where they took a look at the bones and they can identify the patient. Yeah, we can age the patient through the epiphyseal line here. If it's a epiphyseal line, then it's most likely a child, probably adolescent or younger. And if it's a plate, that means it's either an older adolescent or an adult. Okay. You'll also see that there are nutrients. There's arteries and veins running in and around through this bone. You will also notice when you look at other bones when we're in class, or maybe when you start looking at some of the pictures online later, foramen, or holes. And they're holes there for a reason, so that nerves, arteries, and veins can get through. And it's really neat because they need the nutrients. Also, remember the red marrow? The red marrow produces blood, so it has to have a way of getting out. There's also a lot of nutrition here because there's yellow marrow, there's fat, there's a lot of energy, because this production of red blood cells, also known as hematopoiesis, requires energy. And where do we get energy from? Fat. Fat, what does fat do? It stores glucose. So all the things that they told you when you were growing up, like, eat your vegetables and drink your milk, it's important, because remember, calcium carbonates, magnesium sulfates are minerals, right? You can get a lot of it from milk and milk byproducts or dairy products. That helps solidify all of this, okay? And remember, the only difference between the really hard stuff, the bone, and the articular cartilage, or any cartilage for that matter, is the amount of minerals in it, specifically calcium carbonate, magnesium sulfate. And then when you get older, unfortunately, ladies, especially childbearing age, after you have children, it's geared up for your hormones, and your body is now geared up to release calcium, so that you can create milk and milk for baby, even long after baby is grown up. So that's why women are predisposed to osteoporosis. And again, like many things in our human body, if you don't use it, you lose it. All of this starts to fall apart if there's no natural stressor on it. So like I said, I'm a broken record about how workouts are really important. Well, moderation of workouts are really important to keep all the systems going. So that's your typical long bone. And this is a classic picture that's on many exams, including your CCMA, NCLEX, all those kind of things. Now, remember we were talking about how it derives and gets its strength. Well, this is another view of it. Remember we mentioned it comes in layers, right? You can see here, there's thin layers, and of course you have your periosteum. Now, another thing that bone does that minerals or steel or aluminum, something that's solid and not living, what makes also bone strong is that there is a constant recycling of old cells. So you have these things called osteoblasts. Blast cells are precursor cells. I look at them like infant cells. They're immature. They don't do any work yet. But the osteocyte, that's the main bone cell. Okay? So when the osteocyte starts getting old, they get broken down by this thing called an osteoclast, right? So the osteoclast is constantly breaking down old osteocytes, and osteoblasts are constantly making new osteocytes. So this cycle goes round and round and round. Now, when you're younger, this cycle is very, very efficient of osteoblasts, immature cells, making osteocytes, old osteocytes breaking down by osteoclasts, and then the bone gets solidified. That's why when you're younger, you can fall out of a tree and then you dust yourself off and walk away. When you're older, you could fall. Last summer, I always talk about this story. I fell out of my car just from, I have a Honda Odyssey. It's not really a high vehicle. I kind of tripped and I fell out of my car and I thought I broke my back. It hurt that much. And also I felt this weird tingling in my foot. So we had to actually call the ambulance. Nothing happened. I just got a couple of bruised vertebrae and a couple of bruised bones and stuff and a bruised ego. But when I was younger, I fall out of helicopters. I fell out of trees. I did a lot of surfing. I fall on big waves, and my bones could handle it. But when you get older, your bones tend to favor osteoclasts. They tend to break down more things than to build up. And the best way to protect it is, of course, what we mentioned, diet and regular exercise, so that there's constant stressors to your bones or mild stressors so that the cycle can keep on going. Okay, so in review, osteoblast, immature cells that build up to osteocytes, the mature cells that do work, and then the osteoclast, which is the breakdown cell that break down old or worn out osteocytes so that the osteoblast can move in. And that's called bone remodeling. Okay, let's articulations, facets. Now, this is for future reference. And remember I said that there's holes and there's little, there's markings and holes and little things on all bones. Bone, like for example, your femur is not just your femur. It has all these little things in it, projections, protuberances. But the one thing that I mentioned was this one. Did I mention meatus or here, this one, foramen, right? A foramen is a hole, right? Another hole is called a meatus, which is an opening into some sort of canal. There's a whole bunch of little openings, foramen, meatus, even little depressions here, fovea, fossas, and their function usually is to house a nerve, artery, or vein. Eventually, in training, for future training, if you want to go to graduate school, you're going to have to learn all of these for every single bone. And it gets really complicated. But for right now, just know that there's markings. There's little things that on all bones. Like for example, you have this little depression here, and that's your fovea, and they call it capitis or capitis because this is like the head of the bone, right? A tubercle, which is something that sticks out, a sulcus, which is like a groove here, right? fossa, which is a depression here, okay? And this is your funny bone or your humerus. And this is, of course, your femur. You could have crests, things that rise up from bone. If you take a good look at your pelvic bones, right? On your ilium, there's an iliac crest right here. It's like a little lip. And then there's a little depression here, and that's called a fossa. You also have holes, big holes or cavities. They're called sinuses in your skull. That's why your skull is so light. Your head is very, very sensitive, especially, if you've had long hair and you cut your hair and your head feels so much lighter. And also when you have sinusitis, right? And your head feels like a bowling ball because all your sinuses here, these openings in your skull, weigh down your head, and it's very sensitive and it makes your face hurt. Now, the sinuses also have this unique property of, it's also the reason why you think your voice is like the best thing in the world, because you're listening through your voice through the best speaker in the world. And if you look at high-end, very expensive speakers, they kind of look like the insides of your bones. There's no flat surfaces, and it's all oval-like, and you can see here. So the next time you're singing in your shower and your family is screaming at you because it sounds like you're killing kittens in your bathroom, just know and understand that to you, you sound awesome. But to the rest of the world, not so much. Okay, osteocytes, osteoblasts, we already talked about that, and it's another form of remodeling, right? The different types of bone cells, compact and spongy bone. We kind of mentioned that, but let's look at, remember my analogy that I just talked about, how bones are made up of layers, and how bones are made up of bundles of twigs. So if you looked at all the osteoclast, osteoblasts, they form this thing, these layers called lamellae. And even when you look at the word lamellae, it even looks like layers, L and M, just in my head. This whole thing is called an osteon. And within the osteon, there's an artery, vein, and a nerve, right? Of course, they're not colored that. And there are these things called Haversian canals, which connect all of these and communicate with all these. So it's a good thing. It communicates, nutrients and oxygen, and it takes out waste products. But it also can be a bad thing because let's say I have cancer in this part of my bone. Don't you think the cancer now can easily spread utilizing all these canals? And then you could see the difference between spongy bone, which got a lot of spaces, and the compact bone, which doesn't have a lot of spaces, but it's got a lot of layers. And remember what I said, you put all these layers together, you bind them up, and it makes for a very light and a very strong structure. And it's now it's a strong living structure that constantly remodels itself. So that's why when they say things like, your bones are stronger than steel. Yes, they are. Pound for pound, and also bones remodel, and they're constantly repairing itself. Kind of like some bizarre sci-fi thing, but it's not a bizarre sci-fi thing. It is an actual thing. And here's just an example how the whole entire bone is infused with, and remember, red is artery, blue is vein. And by the way, they didn't also add, there's a whole bunch of nerves. So if anything happens to this bone, right, cancer or otherwise, or a fracture or any bone disease, don't you think your body will sense it, and you could sense it in pain? Yep, and that's what happens. Okay. Let us, cartilage, okay. We already kind of talked about cartilage, and nice to know formation of how bones form. But the big thing I want you to know is that when bones form, remember to form from osteoblast to osteocyte. Just know that it pulls in from these arteries and veins minerals such as magnesium sulfate and calcium carbonate, and then fills all of some of these little crevices, and then that's what gives the bone its density, and its helps give it its structure. And every textbook always talks about how bones grow. But let's talk about how bones break. Types of fractures. Here are some classics. Look at these ones. Let's look at these ones up first. Now, closed versus an open fracture. Open fractures are bad because now the bone that has blood vessels and has, well, any fracture is bad, but now you're opening up all those blood vessels and the internal structures to the outside world. So this is going to have a great preponderance for infection. So that's closed versus open, right? Now, transverse means the break came right across. Oblique or spiral, well, oblique is like here, down here. That's diagonal, but spiral, it got twisted, right? You know, it's a fine point, but it happens. Comminuted, not very good, because comminuted means that it shattered. Comminuted fractures are very, very common with gunshot wounds. And just as a little side note, it's not the bullet that is the issue, like in the movies. Like, oh, we have to take out the bullet. The issue is it is the infection that the bullet brings, because the bullet is a dirty thing, and the shock wave that the bullet brings. So, and the shock wave can shatter the bones, and especially nowadays with hydroshock ammunition and hollow points. It's just amazing what human beings come up with and how to hurt other human beings. So a comminuted fracture, it's bad news because it's got little bits and pieces that are flying around. And again, just like the open fracture, it's going to be hard to heal, and it's going to preclude this for infection. Impacted, that's when, impacted or crush injuries usually happen with, well, not only with your long bones, but also with your irregular bones of your vertebrae. When people jump off a roof or something like that, a lot of the energy gets shoved up from the feet on up. So maybe they might break an ankle, but they'll definitely have impacted fracture of their vertebrae. Now, the green stick is unique to children under the age of 5 because children don't have a lot of magnesium and calcium deposits. So and also their bones are growing and developing. Their bones bend, they don't break, and they're not as solid as an adult's. So you'll have a partial fracture, and you'll have, this is semi-inaccurate drawing, you'll have a bending of one side, kind of like a green stick on on a young sapling tree. One side will like bend and the other side will break, like this part. And that's what a green stick fracture is. And they're nice to heal because they're children. Children heal up real well, especially the young ones greater than 5 years of age. Actually, greater than around 2 years of age, or like a 1-year-old, 2-year-old, they have so many osteoblasts that they can essentially fracture their distal phalange or distal finger, and it has a propensity to go back, or at least partially go back. An adult, once you fracture your finger or chop off your finger, you're done. It's not coming back. Bone repair, again, has a lot to do with mineral deposition, and we already know how the blood vessels will help heal the fracture. And do know and understand, when you fracture a bone, it doesn't get better. When you have any damage to your bones or to your body, that's why you have to go to rehab for 6 to 8 months. You don't get better, right? So that area will be an area of weakness, okay? Not like the movies, like, I don't know, because I used to watch Kung Fu movies a lot when I was a kid, thinking that, oh, they broke their bone, they get stronger somehow. No, that doesn't work that way. Exercise and bone tissue, and we already talked about nutrition and bone tissue. We kind of alluded to, and I alluded to calcium and vitamin D. Now, with vitamin D, where's the only place you can get it? You can, of course, get it through food, but a nice source is, of course, sunlight, okay? And then liver and the kidney, and you'll learn more about that. But do know and understand that bone also has mineral deposits. And I've said calcium carbonate how many times already in this lecture. But vitamin D is also directly related to exposure of sunlight. So you could see there are other vitamins, right? And remember what vitamins are. They're also known as cofactors. The vitamins in your body are required to help enzymes move things along. So if you don't have vitamins in your body or minerals in your body, and the best place to get it is, of course, your diet, then a whole bunch of stuff goes wrong. Vitamin D, we already talked about calcium absorption. Again, sunlight, calcium, of course, calcium phosphates, calcium carbonates, hydroxyapatite crystals. All of these things make the bone hard. So, you know, when they did Milk Does a Body Good commercials, if any of you remember that in the 80s, right? That's what that's for. Vitamin K, very, very important in clotting and blood. And your bones got a lot of it. Magnesium, structure. Fluoride, structure, right? Oh, I forgot to mention, your teeth are bones. So that's why they put a little bit of fluoride in your drinking water. And omega-3 fatty acids, osteoblast function. And it's just kind of a side note. And where's the best place to get omega-3 fatty acids? If you poach fish, not fry it, right? Or you could grill it or broil it. But if you poach fish, you know, like you steam it, you get a lot of omega-3 fatty acids. There is a reason why cultures that have a very, very strong fish-based culture, they have a lot of omega-3 fatty acids. Almost, they live very, very long, and they have very little bone and cardiovascular issues. Hormones, growth hormone, of course, affects the skeletal system, but sex hormones, of course, because again, the greater amount of testosterone, the greater amount of bone deposition, right, to make the male frame versus the female frame, right? Oh, yeah, you'll learn this in when you do endocrine stuff. So I'm not really, and it's not really part of our stuff that we were supposed to do today. Calcium homeostasis. Let's talk about calcium homeostasis, because homeostasis, even though it wasn't part of our you know, things to do for our task, but I like adding this because you could now see how the other systems are involved. So if you recall homeostasis, you can look at it like a um, like a seesaw, right? And then if you are low on calcium, right, you want to increase it, of course. Your thyroid releases calcitonin. Calcitonin then kicks up osteoclast activity. Then you have calcium reabsorption. Now, what's calcium reabsorption? Typically, if you have too much calcium, your kidneys will throw it out. But your calcium goes, if you have calcitonin in your system and your osteoclasts need those calcium to build up bones, what's it going to do? It's going to keep it. The kidney will reabsorb it. And then, of course, the calcium levels in your blood increase. Okay? But now you could also see you're going to have bone problems if you have a kidney problem. You're going to have bone problems if you have a thyroid problem. Okay? Now, it goes, if you want to decrease, you have your parathyroid glands. And then you will have calcium getting released from your bones, right? Then goes reabsorbed, and then into your small intestines, and then bring it back up when you have decreased levels. Okay, so it's a nice way to looking at things. And now you know that vitamin D, calcium, kidneys, bone, right, and hormones are now all related to each other in some form, some fashion. Let us now the other thing that let's look at this. Now let's look at the bones, the actual bones. Now, another division besides long, short, flat is axial versus appendicular. So the appendicular skeletal system is this like light green. That's your appendages. So that's your shoulder girdle, which is made up of your scapula and your clavicle right here, or your collarbone. And then, of course, your humerus, and then the rest of your arms. You have the radius and ulna, and your carpals, which is your wrist, and your metacarpals, which is like the palm of your hand, and then your phalanges. You'll notice that your fingers and toes are both called phalanges. Now, how do you know which one's which? Well, the thumb side is always labeled 1, pointer 2, 3, 4, 5. Your big toe is always labeled 1, 2, 3, 4, and your pinky is 5. Phalanges upper extremity, right, are your fingers. Phalanges lower extremity are your toes. You have your femur, of course, patella, your kneecap, your fib, tibia, and the smaller one posterior to it is your fibula. And we call it fib because odds are if you fracture your tibia, you can also fracture your fibula. This is, and of course your pelvic girdle, which is your hip bone, which is your ilium up here, and your ischium down here. So all of these, your pelvic girdle and your shoulder girdle and your arms and legs are part and parcel of your appendicular skeletal. So what should you do when you go home? You can take this, or you can find something to this effect, and then do what? Try to identify everything, right? Now, you're not going to identify everything the first night, but just imagine if you just do 15 minutes a day of all of this. By the end of the term, you're going to get to know everything. Now, your final is going to be a take-home, so it's easy, just look this up. But remember what you're in this course for. You're in it to garner knowledge for future reference. And especially if you're in the Department of Radiology, you don't know what bone they're talking about, you're going to feel pretty stupid. Now, what is the axial skeleton? Now that's the gray parts here. It's your cranium, which is your skull, right? Mandible, which is your lower jaw, your vertebrae, of course, your ribs, and your manubrium sternum, and your corpus of your sternum here, or body of your sternum here, and your sacrum, which is the lower part. And we're going to be talking about momentarily how to identify the vertebrae or your vertebral column of your body. So that's the axial versus appendicular skeletal system. You have your skull, you have your mandible, zygomatic, right? And let's get a better picture. Ooh, here's a better picture. So you go home, you look at these pictures, and then there's all these, especially if you had medical terminology, if you look at the skeletal portion and the end part of your chapter on skeletal system, they have a whole bunch of these and they're blank, and then you could practice them. Your maxilla, mandible here, right? Your zygomatic bone, frontal, right? Let's give you sides. That has your ethmoid and all this other. Then it has also these little sutures. They look like stitches. Remember when, if you have a niece or nephew, or if you had children, you had babies, right? And the children would have these spaces in their head because their brain is growing and they need room to grow. So they had these soft spots. The soft spots were called fontanelles. And when you get older, the bones grow and then they fuse together. And we're going to talk about them in joints, right? And they form these sutures. So you have a coronal suture here between your frontal bone and your parietal bone. And you have your mastoid process here connected to your muscle, sternocleidomastoid, which helps move and turn your neck, right? Mastoid process here. You have a meatus. So that's your external acoustic meatus. So that's going to lead into your inner ear, okay? What else you got? I already mentioned zygomatic, which is your cheek. Now you have your sphenoid, which is part of the inside of your skull. And then when you look a little inside on the inside of your eyeball, that's your ethmoid. Okay. Here, your temporal. And your temporal and your parietal bone is separated by your squamous suture here. You have your lambdoid suture here because on the back of the bone, it kind of looks like a lambda or like a triangle. And this bone here is your occipital bone or your occiput. And then there's more things. There's more fossas when you open up. And that's where your brain sits. The frontal part of your brain will sit in the anterior fossa, your temporal in the middle, and the posterior portion of your occiput or your occipital part of your brain will be housed here in the posterior cranial fossa. And you could see the brain sits inside and there's little space, and that space is all full of fluid. So you could see the human being is like a very, very interesting puzzle. All right, now that's getting too specific. And this is the one thing I wanted to mention, this huge hole. That's your foramen magnum. And the foramen magnum is going to house the top parts of your vertebral column, and it's going to connect your spinal cord into your brainstem. And you could see how whoever built us perfect. They put all the really important stuff and all the really dangerous stuff in the back. And that's that lambdoid suture because it kind of looks like a triangle, and this is looking at the back part or the posterior view of the skull, right? So this is like inside of the teeth. Okay, nuchal line or nuchal rigidity. That grows exponentially if you're on steroids. Gives you that Cro-Magnon, look like a caveman or cavewoman look. Ethmoid and sphenoid, and nice to know. But eventually, really should look in greater detail. But I just wanted to give you a grand overview. And again, the sinuses, you have your frontal sinus, which is near your front, sphenoid, which is like on the inside part of your nasal bone. I mean, the ethmoid is the inside part of your nasal bone. Your sphenoid is more on the lateral side, right? And your maxillary, of course, will be in the maxillary bone, within the maxillary bone. So sinuses are, or also known as your paranasal sinuses, because they're all around your nose. So when you get sinusitis or, postnasal drip and stuff like that, all of this starts feeling heavy and congested. Your hyoid bone right here, right above your larynx. Your larynx is your voice box, and that's made out of cartilage. So let's look at the vertebral column. You got a better picture of that? Okay. Oh, this is how they're going to do it. Okay. So when we're looking at the vertebral column, and you know, don't memorize these things here. That's again for more future things. But do know and understand that you have your vertebral foramen, you have lamina here, and you have these articular processes that connect and articulate with the other bones. Now you have 7 cervical vertebrae, and they're numbered C1 through C7. C1 is your atlas. That gives you the ability to shake your head yes. C2 is your axis, and that gives you the ability to shake your head no. That's a common anatomy and physiology question. And of course, C1 through 7, there are 7 vertebrae, and you could see here, even right now, feel the back of your neck. There's going to be like a bump that's sticking out, and that's your C7 prominence right here. And that's how you can kind of like measure up where your cervical vertebrae is. And if you notice the cervical vertebrae, they're very small, they're delicate. And it makes sense because your neck has to be able to move around and to be very, very loose. Now, if you look at your thoracic vertebrae, what makes them very, very interesting is that they're a little bit bigger, and they have these articulate facets and these things called a pedicle, right? Kind of like a pedestal kind of holds this up here. And they have this on both sides because remember, your thoracic vertebrae also have to connect into your ribs. Now you see in your sacrum, your sacral vertebrae, and that's S1 through S5. They're really, really big. And you could see the body is very, very heavy. And you have in between all your vertebrae is your intervertebral disc. And if that pops out, you have a slip disc or a nucleus pulposus herniation, right? And that's going to cause a lot of pain because remember, there's spinal nerves coming out of this thing. And last but not least, your sacral, which is 6 fused bones, and then including your coccyx, and they're here on the very, very end, and your coccyx is your tailbone, okay? So in review, if you look at this, you have your cervical, 7 of them, thoracic, 12, lumbar, 5, and you have 6 fused bones, which are your sacral, and ending in your coccyx, which is your tailbone. Here's a classic intervertebral disc, and what happens when the intervertebral disc has a herniated or a part that's sticking out that shouldn't be sticking out, and that's called a nucleus pulposus herniation. You could see the cartilage on the inside starts creeping out, and then what will it do to this spinal nerve? It will impinge on the spinal nerve, and 1 or 2 things can be caused. It'll either cause numbness or pain or both. And this is not fun to have for obvious reasons. And then we could do surgery, push that all back in, but you could see how very dangerous this all is. Okay. All right. It's very thoracic cage. And again, my apologies if I'm like kind of breezing and going by, and that's why we like typically if we were in a class, we'd be in a classroom, we'd be touching, feeling, looking at it, and taking more of our time. But again, my Zoom lectures have only so much memory, so I'm kind of trying to get as much as we can for this lecture. So again, my apologies if I'm like, because I'm going pretty fast. We already mentioned the Manubrium, right, which is part of your sternum, and then you have the body or corpus, and it ends in with the xiphoid process. The xiphoid process is cartilage, and it's very important because that's the landmark of where you put your hands in CPR, this part right here. Now, let's jump down from the sternum. Let's go to the ribs. because there's a numbering system in the ribs. What? Oh, these are the remember the fontanelles, and then when your head grows, all this will fuse together. So for the sake of time, I'm going to find ribs. They didn't have another picture of ribs? That's it? That's a jip. All right. We have the almighty Google. Let's look at ribs. Boop. I don't want a video. I just want a picture. Oh, give me a break. Is this another video? Oh, no. Here we go. Okay. Now, you have 12 ribs. Okay? Now, the true ribs are ribs 1 through 7. So 1, 2, 3, 4, 5, 6, 7. They're called true ribs because if you see, they connect into cartilage that connects directly into your sternum or your breastbone. Okay? Here you have your jugular notch, and above it, your clavicle. So these are areas on how you measure intercostal spaces. And that's important for EKG. That's important also for chest pathology and chest physical examination. So you're able to count these spaces here. Okay, so 1 through 7, those are your true ribs. Now, 8, 9, 10, 11, 8, 9, 8, 9, and 10 are called false ribs because if you look at 8, 9, and 10, they connect into the cartilage of rib 7. So those are called false ribs. Now, your 2 floating ribs, which are designed to protect the inferior poles of both your kidneys, that's ribs 11 and 12. Okay? So to recap, true ribs, 1 through 7, false ribs, 8, 9, 10, floating ribs, 11 and 12. Okay? And I don't know why they didn't have that picture. I guess they probably had it in the explanation portion. All right, it's at this point where because there's a lot of stuff, and we went through a lot of things, and I'm going to make I actually made it already. I'm gonna put in a separate video regarding joints because I want to be able, because if this thing goes too long, it starts having difficulty saving the video. So what's the review for this week? What's due next week? Of course, today, task 5, discussion 5, lesson 5. Your midterm grades are already up. They're based on weeks 1 through 4. No midterm for this particular class. So we just keep on going until the end. And task 6, of course, the things that we discussed. All right. Oops, wrong class. Let's go back to 210. Ugh, slow internet today. So if you look at what your tasks for next week is, of course, do your structure of the skeletal system, concept map, function of bones, support movement of joints, support movement, and I'm going to have a separate lecture that I'm going to put up about your joints. So try to, I see several of you give me like one for this, one for this, one for this, one for this. If you do that, try to make it in a way where you can show me where one connects into the other, because sometimes you guys don't do that. And it's to build your skill set for to take material and then to put it all together. But I believe this particular chapter is pretty straightforward and it's pretty well organized. Now discussion. Let's see what's for next week. 3D printed casts used to stabilize broken bones. Yeah, we're doing a lot of 3D printing stuff in orthopedics. So again, this is brand new stuff. So try to get a citation from a legitimate source, .org, .edu, and sometimes students just put a source for the sake of putting a source. Make sure the source, you actually refer back to that source somewhere in your in your paragraphs in your submission. Like, don't just put a source that, hey, this is a nice source and it's kind of saying the same thing that I'm saying. Actually quote it and actually take a piece and make that piece support your opinion and rationale. And here, and of course this definitely, I'm looking for stuff very, very recent, because this is 3D printing is very, very modern. And now it's also now relatively affordable. And lesson 6, application assignment. Oh, I think I forgot to send, because there's some of you that have trouble opening up PDFs. So of course the application assignment, click on this, download the case, and knee injury and recovery. So of course, part 1, part 2, part 3 questions, and part 4. They're very straightforward questions. They're just referring back to these little paragraphs. So all parts, because they're short and they're easy. And remember, some of you write a book. Don't just answer the question. Like, why was she shivering? She was shivering because of the following. I don't really need to know the whole entire pathophysiology of shivering. Okay, so very straightforward when you do your lessons. Okay, with that being said, let me get the attendance. Alrighty, with that being said, thank you very much, ladies. And if there are no questions, comments, or recipes, I bid you a good night.
Dr. Garais.
Shoot.